When you hear percentages of people getting infections, the hospitals say, well, we've got a good infection rate. It's 0.01. Well, I was at 0.01. I'm that person who got the infection. And so, if your infection rate isn't 0, you don't have a good infection rate because somebody is going to get hurt. And my goal is that no one gets hurt in the future. We finished the study. In the back of my mind, I kept thinking, okay, the particles are on the floor, but how did they get in my wound? That question kept going over and over in my head. The one thing I didn't know at that point was that everyone who has surgery that lasts longer than an hour has some type of warming unit. So two types are forced air warming and the other is conductive fabric warming. And I do know that the hospital I was at did use the forced air warming units because they offered it to me pre-surgery. I said I was warm enough, I didn't need it, so I just assumed that it wasn't used on me. And then as I did more and more research, the more I learned that they have to use some type of warming unit. I think it was used on me. And it makes sense that is how the particles from the floor got picked up by this blower and then deposited on my surgical wound. Then I continued to look for research, and I probably read about 20 articles, pros and cons. I mean, there's people who will say this is all wet and this is crazy, and then but the pros seem more positive to me and more. It makes more sense. The cons just say, well, it doesn't make any difference. It doesn't make any difference. Yet I spent a whole couple weeks studying about the particles on the floor and how to minimize them, and yet now you're telling me that it doesn't make any difference that they get sucked up and blown across the patient. So that doesn't sit well with me. I feel it's real important if you say something shouldn't happen, then it shouldn't happen. Then particles shouldn't be blown across the patient. So to me, that is like creating a perfect storm for something to happen. I have a foreign piece of metal going into my body. I now have foreign particles being blown across my body that can drop into that, and then they close it up. And you close it up for 2 weeks, and now you have, what do you have? You have a perfect place for infection to grow. And it did. And that's what happened. Why take the chance in a surgery to have something happen? Why take the chance of losing your leg? Why take the chance of losing your life? I mean, remember, way back when, they told me I had 30% chance of living. That's a small chance. I mean, they give cancer patients better chances than that. And this is for life. For the rest of my life, I'm going to have a bug inside my body that's impossible to get rid of. I would have thought about this differently if I would have had the chance.